So this was a session that was with myself, another MS specialist, Dr. Annette Okai, and a patient advocate, Victoria Reese, from an organization called We Are Ill. And we shared data about MS in minority communities, particularly African-American populations. We talked about the prevalence of MS. We talked about the things that we know about the course of disease in this population, that sometimes it can be more severe, but we also talked about knowledge gaps. And we tied that data to survey data that we had conducted across several MS centers and general neurology clinics, where we asked patients about their goals for treatment and saw how those either aligned or in some cases did not align with what their providers perceived were the top goals and top priorities for people living with MS. So what we found in the data sets were we surveyed the providers within a practice. And so there were 4 MS clinics that were surveyed first, and then there were 8 general neurology clinics that were surveyed. And so we compiled a lot of that data. We asked providers what were their top goals for treatments, or what they thought their patients' top goals were, what were the most important things in treatment decision making. And then we also split the patient populations into white patient populations and Black patient populations to see if all of the goals aligned. And what we found was that in many cases, there were alignments between the groups, but in some cases, whereas providers may have been more focused on things like side effects, patients may have been more focused on quality of life and effectiveness of therapies. And so again, kind of underscored the fact that we need more shared decision-making, and that we need to be asking our patients more about what their goals are and what they want to accomplish with treatment, instead of assuming that we know what they want to accomplish. So I think some of the valuable insights were, number one, the data is now showing that the prevalence between Black and white populations is similar in the U.S. So, these numbers we've been looking at over years. And so over the past decade, we have this body of evidence suggesting that MS is much more prevalent in the Black population than we previously thought. But those numbers are actually getting to be very similar from more recent data. So first, that MS does occur much more frequently in minority populations. We need to be looking for it. And when we're trying to understand the research that we have suggesting that outcomes are worse, we need to be focused on social determinants of health, things that affect a person's access to care. And again, also making sure that we're aligning those treatment goals in the everyday treatment process to make sure that we're meeting the needs of all of our patient populations.